This is Knox-White, the mayor of the city of Greenville, here at City Hall, but we have with us Dr. Wendell James of Prisma Health and Dr. Marcus Blackstone of Bon Secours St. Francis. And what we tried to do in these news conferences periodically is to cut away some of the clutter of the national story on coronavirus and even the international story, because this is an international pandemic, to try to zero in on what's happening here locally, what's happening in Greenville, what's happening in the upstate. And that's just not a matter of infections and spread, but also the results of the hospital capacity issues, of what's happening in terms of people being admitted into hospitals. And that issue of hospital capacity is very, very important, and we know we'll hear some of that from our people here today. But it is Thanksgiving, so as you might expect, we'll be talking a little bit with these gentlemen about what the responsibilities we all have. Again, we've been hearing about this a lot in the media, and I think everybody's made decisions about whether to travel or not. They've probably made decisions by now about what Thanksgiving is going to look like in their homes. But it's very important, again, to hear from our local healthcare professionals. What do they think about the Thanksgiving holiday, the impact it probably is going to have inevitably on hospital capacity in the next 2 weeks, as well as, again, other reminders of what we all can do to help stop the spread and make it a little less so, if you will, in terms of spread. Because we know there's going to be an impact. There always is. Just talking to these gentlemen a moment ago, I learned something I didn't really know, that even Halloween had a decided and noticeable impact in terms of hospitalizations. So there you go. Every holiday, every time people can kind of come together, it seems to have an impact. I think that's a really important thing to be reminded of. And again, we're focused on the local impact and what we all can do locally to do our part to stop the spread so we can move on to some normalcy later on. With that, Dr. Blackstone of Bon Secours St. Francis is the first one to speak today. Okay.
Thank you, Mayor. Good afternoon. Dr. James and I really wanted to focus today on a couple of really important aspects of the COVID situation here in Greenville. Our hospitals, we struggle, with our capacity, and you've heard us talk about this over and over. And, this is really kind of our third round. And so, we aren't even in the flu season yet. And, yet we're pushing our capacities in our hospitals. And it's not just, it's not just Bon Secours, it's not just Prisma. Spartanburg and Med, Greenville are all pushing the same thing. So we really are trying today to get people to realize is that, this surge is preventable. And, one of the big pieces of this that makes it preventable is actually the mask. You've heard me talk about this from the very first press conference. People, if they will mask and they will, stay out of the group settings, like we've talked about, but in particular, if you'll wear a mask, if you'll wear it right, dispose of it right, when you get done with it, that will make a huge difference, from our standpoint. And so, that along with the safe distancing part, really will limit, what we could actually, face here. And you'll hear Dr. James talk a little bit about the cycle that we see, which is 2 weeks after, an event, we start seeing another rise in cases. And, we saw this at Memorial Day. We saw it July 4th. We saw it Labor Day. Now we've seen it Halloween. Now we saw it after Election Day. And now we're headed into Thanksgiving and Christmas. And I'll let Dr. James, talk about that from his standpoint. But, realizing that, that's our concern as healthcare systems, that we continue to see these rises. And, now you're going to add on top of it flu season, which we already have a significant increase in our hospitalizations just from flu season alone in a normal year, much less this year, which we all know is completely different than what we've had before. So really what I want to do is really, make sure that people understand the mask, piece of this. And so there's multiple types of masks. So this is a disposable mask that's not meant to be worn for months at a time. It's not even meant to be worn for weeks at a time. You wear a disposable mask. If it gets dirty or the inside of it starts to, fray, where you start seeing little fragments of material, it's time to actually get rid of it and get a new mask. The other thing is, when you get rid of it, please throw them away in a regular trash can so somebody else doesn't have to handle them. I go through town, I see them in buggies, I see them in parking lots. Make sure that, that when you get rid of it, you have to assume that it's already contaminated. And so, make sure that you throw it away in a regular trash receptacle. And then you have cloth masks, which a lot of people wear, from a standpoint of they're more comfortable, but make sure that you wash those once a week. It's not good to just continue to wear it over and over, but not wash them, as well. So, if you'll do those two things, but the biggest thing is if you will actually wear a mask when you're outside of your home, where you can avoid groups of other people, that will really help, put us in a better situation as we get through the rest of the holidays. So just to make sure people understand, if it's a disposable mask, pull it out and spread it all the way out. And then, put the loops over each ear. Make sure you pull it above your nose, and then there's a metal strip. Press it on both sides, and that actually seals it. And actually, if you wear glasses, that will kind of minimize some of the fogging. This is not a proper way to wear a mask. This is not a proper way to wear a mask. You have to cover nose and mouth to be effective, and for the mask to be effective in helping spread the COVID virus. Thank you.
Good afternoon. My name is Wendell James. I'm the Chief Clinical Officer for Prisma Health Upstate. I'd like to thank Mayor White, Dr. Blackstone, and all of you for the opportunity to talk today about the importance of being cautious as we go into the holidays. I've talked before, many times before, about our responsibility to one another. The one thing we have absolutely got to pay attention to through the Thanksgiving, Christmas, and New Year's holiday is our responsibility to not make one another ill. We have many, many family members coming in from all over the country around this time of year, and it is imperative that as we do this, we take the responsibility of keeping our guard up, being careful, and taking precautions. The one thing we do not want to do is turn this wonderful holiday season into a tragedy. And that happens because we let our guard down. So one of the things I would plead to everybody today is to keep your guard up as we go into the holiday season. One of the things that we are seeing is a temporal relationship to every one of these large holidays that we are seeing over the last several months. We've been doing this now for going on 10 months. And we've got lots and lots and lots of data points to look at. And when we look at those data points, what it shows us is there's a relationship to very social holidays and a rise in the number of cases. We particularly saw this after Memorial Day and the 4th of July. We came out, we talked to everyone through these venues. The press was kind enough to let us plead with the public to partner with us on this, because at the time, in the middle of July, we were seeing a significant rise and a severe spike in the number of cases. What we've seen over the last month is that trend turning around and starting from a baseline that is already above where we were in June and July to somewhere that's approaching the trajectory of what we were on towards the middle of July after the 4th of July, if that makes sense. So right now we're looking at a very rapid rise in the number of hospitalized patients as a result of what it looks like of probably the period around Halloween. This is very predictable. We're seeing this almost routinely about 2 weeks after an event or a holiday. And why are we here today? We've got another holiday, and this is an incredibly social holiday, and we would like everybody to be aware while you are socializing with your friends and your family to be careful, be cautious. Do not let your guard down. If you do, people will get ill, and we don't want to see that. We have seen enough of this. We have a vaccine on the horizon. There is a light at the end of the tunnel. We've got some time before we get there, though. And we need everybody in the community to take the responsibility to one another. And let's be careful through Thanksgiving, Christmas, and New Year's. Let's keep this virus under control. How do we do that? Well, Dr. Blackstone has already spoken to one of the main things to do. I hear people on social media railing against masks and all these other things, but the fact of the matter is mask, social distancing, and hand hygiene work. That is all you can say about that. They are absolutely the best thing we have got to control this disease until we can get the vaccine and get people get general vaccination in place. And that's probably going to be after the first of the year when the general public gets access. We do expect to see this sooner than later. So like I said, there is a light at the end of the tunnel, but we cannot put our guard down going into Thanksgiving, Christmas, and New Year's. What we are asking you here today is to partner with us. Once again, be our partners. We need everybody to take precautions throughout Thanksgiving. Mask, social distance. If you're in a tight environment like your kitchen with a group of family members, mask. It's a little awkward, I admit, but everybody wearing a mask is something that will be much better than not in the long run. We do expect to see the numbers continue to go up after Thanksgiving, and that is why we're here today asking for your partnership. If we work together through Thanksgiving, through Christmas, and through New Year's, and we're responsible to one another and we're responsible for each other's health, we can get to the vaccinations and get to a time period where we can get back to a more normal existence with a minimal amount of this disease spread. So once again, I'm going to reiterate, hand hygiene, wear your mask properly, and social distance when you can. If you do all of those things, then we do not expect to see these numbers continue to rise at the rate they are. If we don't do that, they will continue to rise and it will become somewhat problematic towards the first of the year. We don't want to see that. One of the things that we think will hopefully turn this around, and it will actually help us significantly, is once we start vaccinations of the elderly, hopefully between now and the first of the year, and those at greatest risk, we can hopefully mitigate some of the really severe cases that we're seeing. But we're a little ways off from that. Just work with us a little bit longer. That's all we're asking today. Anybody have any questions?
Reminder, reporter questions back here so we can hear you on the live stream. Just introduce who you are and what you want to ask.
Hi there, it's Gabrielle Komorowski from WYFF4. You talked about a very rapid rise in the number of hospitalized patients. Could you be specific about numbers, please?
No, I can't be specific about numbers. Our numbers change from morning to night.
How dire is it?
When you look at the situation inside of Prisma, we are over 200 patients in the entire system, upstate and Midlands, and we peaked out at around 300. So we're 2/3 of the way back to July, and we've done that in a very, very short period of time. When you look at the curve, it's nearly straight up, and it's actually rising steeper than it did in July. That's why I'm here today. I don't want to get to 300 and have this conversation.
Another question. Could you walk us through very specifically when we should get tested? I know sometimes we've heard to get a test even if we don't have symptoms. Other times we're told to get tested after we've been exposed to someone known to be positive. But when is that, right? Was that right away? Do you wait a couple days?
So, when you talk about testing, it's really situational. Because you got to be careful with testing from a standpoint of, depending on when you get tested and how you get tested in the disease process, you may be negative and it's actually, you just haven't actually developed COVID yet. And so it can give people a false sense of security. For the general public, here's what you need to understand. If you're sick or you don't feel good, you need to stay home. You need to stay away from other people. All of our systems now have, telehealth, video visits. We have the ability for you to connect with healthcare providers who will actually look at your situation. Were you exposed to somebody? Do you just feel bad? And they can actually walk you through that. So that's how we determine the testing piece and when it needs to be done. But we would encourage everybody else to use our video capabilities to be able to, to decide if you actually truly need to be tested or not.
Not to hog the microphone here, but I'll keep going.
So one other point with respect to testing that I'd like to make clear. If I test today and I'm negative, it doesn't mean I won't be positive 2.5 or 3 days from now. The test tells you today I was negative. So the thing that people need to be very cautious with, and we want them to understand, is all you know is that moment in time. This disease is exceptionally prevalent in the community. It is everywhere. We are seeing it all over the place. There's nowhere it's not anymore. And so the fact that you are forced to be in crowded areas, like we've probably got 30 people here today, everybody's masked, it minimizes the risk of the disease spread. But if you were tested at this moment, you'd probably be negative. It doesn't mean that you haven't acquired the disease and would be positive 3 days from now. To his point, when you're ill, if you have it, that is when you will most likely test positive. There's a window from the exposure to the test actually being sufficiently, for you to have sufficient amount of virus to be positive as well. So there's a window in there that you may have been exposed, you may be infected, but you still haven't tested positive yet. So a test is good, but it is not perfect, and it is not insurance that I can't make someone else ill, okay?
Kimberly Brown, 7 News. What is that window? Is it 7 days, 3 days from exposure to actually full-blown infection?
So the full window is 14 days. So from the time of exposure within a 14-day window, you could actually convert during that time period. What we do is ask people to look specifically within the 7 days, especially if it is a direct exposure to a person who's positive, then we're looking for symptoms in that 7-day period. But remember, it goes back to what was originally said. It's a 2-week period that somebody can convert from the time of exposure to actually, having virus levels enough to have symptoms and actually develop COVID.
Didn't know if new data had brought some changes. My original question, families are no doubt going to get together for Thanksgiving. Can you give us some tips, some insight on how to stay safe aside from the mask and social distancing when they're in the living room, when they're in the kitchen? Just give us some practical things we can do to stay safe together.
Okay, well, I've talked about this before. Number one, you limit the number of people. Immediate family only. Do not bring in distant relatives and extended friends. That's what the history of my family, but we're not doing that this year. My brother and my sister, we're all doing it at our own homes, and we're minimizing the number of people that have to be inside of a small area. So minimize the number one. Number two, when you're inside together, wear a mask. If you have immediate family, like your immediate small children, you've been exposed to them on and off every day. But you bring in adult children that you don't see, like we're going to have, they'll have to wear a mask when they're inside. The other thing is how you serve food and how you interact around the table. You should separate while you eat, because everybody has to have their mask down during that. Anybody that doesn't feel good this holiday season should stay home. If you have elderly parents, mask the parent. Make them wear the mask the entire time they're in the celebration. That's what we do. So separate mask and serving food. One of the things that we need to pay attention to, I don't know what all of you do, but we have the food set out on the serving table and everybody gets their own food. Do not do that this year. One person that is masked, preferably gloved, should serve the food to everybody. Don't let people serve on an open buffet at home. That is a good way. If one person in that group has it, that's a good way to give it to everybody. So you have to assume if you got a group of 10 or more that probably one of them's got it, and you should do everything you can to mitigate the spread, especially to those that are at risk. So the elderly should be masked the entire time they're in the group. Beyond that, Keep it small, keep it really tight, this from a standpoint of your family members, but spread them out. We're going to have dinner outside where we can put everybody at their own place. I think, if we're not going to not celebrate. That's not a realistic expectation for people to do that, but we can do those things to mitigate the risk. Okay? Anything else?
One last question. When should someone go to the hospital? If you're not feeling well, do you wait, 14 days? When do you decide when you go to the emergency room and not just call your primary care physician?
The first thing you should do is call your doctor. We have both systems. Pretty much every system in the upstate has put in virtual platforms, and what that does is give you the ability to contact a physician either online or on the phone. If not, it'll be a nurse practitioner or a provider of some kind that can help make that decision for you. If you're ill, if you're short of breath, chest pain, you still need to, if you're having acute symptoms and you're worried for your health or your survival, you need to come to the hospital. We'll worry about the COVID when you get there. The truth of the matter is we do not want people not coming to seek care. It is imperative that if you are having an emergency situation, do what you always do. Call 911 and get to the hospital. But for just, I don't feel good, I got a fever, I'm aching all over, I think I might have it, use a virtual platform, because that way you don't have to travel, you don't have to expose other people, you can do it from home. And what we will do in most of the systems will put you on a callback system, or at least a system where we can make sure that you're doing what needs to be done moving forward and everything's like it's supposed to be. Does that answer your question? Okay.
Hey, Eric Conner with the Post and Courier. I wanted to follow up on the hospitalization question. Back in July, you had said that in 2 weeks, if we didn't wear masks, that hospitals would be overwhelmed. You're saying we're 2/3 of the way we were in July. What are we looking at in terms of if we don't do what you say? Are we looking at the same situation that you talked about in July, especially with us being inside more? Unless you consider the air conditioning back in July, there's more people inside.
So yes, it's even more of a reality today than it was back in the summer, because we didn't have the flu piece. People were outdoors, but now that it's getting colder, people going indoors, you add flu. It's a real possibility. I'll tell you, Bon Secours, we trade over beds every day. As we empty beds, we fill beds right back up. We don't have a bunch of empty beds sitting there, and I know it's the same thing in the other upstate hospitals. So our COVID levels, even though they went back down some, they're still higher on average than they have been, since the summer. So we're starting at a higher level as we go into this next rise. So it's a very real possibility. If you look around the country, you've got a prediction. There's a lot of places in the country within the next 2 weeks are saying they're going to run out of beds. Where the numbers have really increased from that standpoint. So it is real. It's not just Dr. James and I sitting here, trying to use it to get people to do the right thing. It's very real in our world, and I've said this many times. This is what keeps us up at night, is not having the ability to take care of patients in a situation where it's preventable.
So, does that answer your question?
Almost.
Okay.
Because I'm going back to July. Like when I write what I'm going to write, I'm going to talk about July because you mentioned it. Back then, I remember you saying, in 2 weeks, if y'all don't do this, our hospitals are going to be overwhelmed. And so I'm just trying to get to the point of like...
So where we were in July, we were coming off a mandated shutdown, and we were seeing a logarithmic rise in cases. And at the time in July, every hospital in the upstate area was struggling to meet the demand that was on it. We were in the best probably position of all because we have more hospitals to work with. But when, I'm looking at a situation where things are getting exceptionally tight and the rate of rise is not turning around, it doesn't take rocket science to project at what point you're going to reach a point where you can't handle it. So how would we deal with that? What happened back in March? They told us we had to close things down. That was not a good thing. And it's not something that we ever need to do again. But we have to have the public partner with us to manage through till we can get vaccinations. And if we can do that, we can continue to maintain full operational capacity at all of the systems in the upstate. The one thing we need to be able to do is make sure that the chronic disease process that is endemic in the heart disease, the lung disease, the diabetes, the renal failure, all of that has to be taken care of. And the one thing that happened during that shutdown, people were afraid to come get the care. And it was a significant problem after everything ramped back up, because now we were dealing with what was turning into a very rapid spike, and the chronic disease that had been put off for 3 months suddenly all needed to be taken care of. It doesn't go away, and it doesn't get better without management. So we want people, if nothing else is heard today besides distance, wash your hands, and wear a mask, get your chronic disease and your checkups you are very safe to do that. We do not want people delaying their usual health care. But what we don't want to be forced to do is what happened in March, where we were told we had to close elective procedures down, and it scared people to death. People can get their care very safely. We've been doing it now for 10 months, and we just want people to know that we're here for you. All the systems are capable of taking care of this at this point, and we intend to continue to be that way. But this is a partnership. The community and the facilities and the systems in this upstate are partners in their care. We have to work together to get to where we have everybody vaccinated. And once we get to that point, we should see this start to go down very rapidly. These vaccines look to be exceptionally effective. We just got to get through the next couple of months, through the 3 most social holidays that we have in the entire year. And we know 2 weeks after a big social event like 4th of July or a holiday like Thanksgiving or Christmas, we can expect to see a rise. And we would like to see a minimal bump. I'd rather these numbers to just go sideways right into vaccinations. And that would be the ideal thing. So does that help a little bit more? Okay.
Hi, this is Haley with the Greenville News. I was wondering if you can talk a little bit about what you're seeing in the hospitals right now in terms of severity of cases, flu cases, how that's being handled, and if you have any concerns with capacity yet or when you'll make that call.
So, we've talked about before that, each time we get into another rise, we talk about the severity of cases. So we still have the COVID patients who are, in the ICU, very sick. We have the other ones who are sick enough to be in the hospital, managed on the floor. That's turning into about a 7 or 9 day length of stay on the floor. We're still at 2 to 3 weeks in the ICU. It takes a long time to get a lot of the really sick COVID patients well. The other thing, and it goes back to what Dr. James was just saying about beds, because people have put off chronic disease care, what we're seeing is the non-COVID cases that are coming in now tend to be more serious. So somebody who was having that stuttering chest pain, who would come in, get evaluated, they would go to the cath lab and they could have an elective stent put in. They keep putting it off. Well, now that the lesion has actually gotten tighter, now they're coming in with an acute myocardial infarction. Now it's a more emergent situation. They require critical care. So that's what we're talking about when people have put off care. Now it's shifted to a more severe type of chronic disease care, and so that takes up ICU beds, takes up ICU resources, and so you get that that's talking about. So you get that, which has been there now for about 4 to 5 months, and that really hasn't drifted down. But now you add a COVID rise with it, and that's where we get into the situation, the bed situation, from our standpoint.
Dr. James or Dr. Blackstone, do you have any final comments? If not, we'll have the mayor wrap things up.
Thank you for those questions. As we've done this through the summer and into this fall, the question Eric Connor raised just a moment ago is a good one about what was happening in July. It really pointed out in July, in the middle of the summer, what Dr. James said, that we're in a partnership here. We can, all of us, affect what happens and what the trends are. So in July in the summer, we had a real moment of almost crisis, if I can use that word. And with the warning bells were going off, and you heard from the healthcare professionals about that. But something, and that was after 4th of July in particular, but I think it's also important to note that something kind of beneficial happened during the summer too, and that is along about July, in that time period when things were so bad, that's when the call to wear a mask really got serious. And while local governments stepped up to talk about masks and require masks and all that, I want to say in particular it was important that businesses did, that the grocery store chains, that the big boxes, a lot of these places that suddenly were resisting us suddenly were not, and suddenly more and more people were wearing masks. And it happened in a relatively short period of time. And again, I'm not talking nationally or internationally, I'm talking about here in the local area, in the upstate, in Greenville. In a fairly short period of time, people began to wear the mask. And we saw an impact. We saw an impact. And I'm not saying that. The healthcare professionals are saying that, and DHEC said that there was an impact. So we know that there's a partnership going on here. It's actions we take. So the alarms are ringing again, but unlike the summer, we're now in the winter, and we're going to have the holiday coming up, but we also have generally colder weather. So it's going to be more challenging in many respects. I think you would agree, right? Winter's going to be tougher than summer. So, we don't want to be Wisconsin and the Dakotas and Illinois. We don't want to be the places, the real hot spots around the country. But it's our choice and whether that happens. So I thank Dr. Blackstone and Dr. James for their reports. I think they raised some serious concerns about where we are now with the hospital capacity and that kind of thing. But more importantly, that once again with this holiday, there'll be an impact. Let's just hope it's not as great as it might be. If everybody will do their part, it won't be. Thank you.